Welcome to the update for July 2017 of the Lewisham, the first of its kind in Lewisham, the Lewisham BME Mental Health Carers Forum. Now, as I mentioned briefly, this is the first BME Mental Health Carers Forum for those in the London Borough of Lewisham. The forum is run in conjunction with Family Health ISIS, who provide community support for those in mental distress and also advocate for their carers or family members. The forum usually is chaired by myself, and basically we examined how the forum should basically take place and why the forum should exist. Now, as I've mentioned, with over in the Southwark Mental Health Carers Forum, we have not much of an idea of how many BME carers, especially those who are caring for someone or supporting someone close to them suffering from mental illness, have any idea about the mental health services in that borough, or perhaps any idea on how to influence such services, or at least engage with the service providers. I do again feel not just carers, but again BME carers need some empowerment in their role, and hopefully the forum can be a physical platform to engage and empower BME mental health carers. What I mean by BME is black, minority, ethnic. Now, there is of course a large community of BME in Lewisham, which obviously makes sense why I've sort of pushed to have such a BME carer forum. But also, there's been a history of discrimination, stigma, and unfortunately a lack of understanding of mental health. And the forum wishes to investigate what causes such issues and how they could be tackled, not just by ourselves, but those who work in the community or work within the Mental Health Trust to try and tackle such issues. Now, other reasons for the creation of such a forum is that obviously there is unfortunately a high rate of BME using the mental health services, and not all, as you might already know, not all of those who are suffering mental health problems might be lucky enough to use mental health services, or they just do not engage with them. So again, we do not unfortunately know the number, so this is something we should, as a forum, should try and query any data with the aid of Healthwatch on what are the cases regarding high BME usage of the mental health services. There's also been several studies and research requiring input from BME communities, but there seems to be minimal reach, and again the forum could look into why. So at the forum that took place on Friday the 28th of July 2017, some important questions were raised. Hence, what is the quality improvement for BME carers? Who's monitoring this? And if we are given the data, there should be a breakdown of that data. A lot of discussion focused on the stigma experienced by BME lived experience users, I would say, and the carers. We also told stories of what it's like to be a BME mental health carer, and again, stigma was the most common theme. Within the group, we felt that there was a lack of education and information on what mental health means within the BME community, and we felt that somehow that is affecting the BME community, but we want to know how this could be tackled. One of the members of the forum stated there needs to be mental health education for young BME communities, but wondered how this was progressing. And there also was a problem with mental health jargon occurring when exploring BME mental health carers issues. We looked at who should engage with the forum due to browsing. One of the books that I was perhaps reading, a report actually called Meeting the Public Sector Quality Duty at South London and Maudsley, and this was written by the Quality Manager for Organisation and Community. and also suggested that who should engage with the forum was the Equality and Diversity lead at Lewisham CCG. But in order to have more speakers, we need to help grow that forum more, and it must feed off the Family Health ISIS carers support groups. This concludes my update for the BME Mental Health Carers Forum